A second approach, policy choice, is to address mental health outcome by explicitly tackling the social determinants and conditions that impact health, the conditions that we are all living in. I would like to illustrate this option with 3 examples. The first one is related to addressing health as a well-being of the population through the promotion of physical activity, for example. The second, through community involvement in violence prevention in Brazil. And the third, through the promotion of social cohesion and healthy aging in the US. And I will address also quickly Japan. This is, you may remember, in Preston, I mentioned Preston at the beginning of my presentation, how the local government mapped out inequities in health and related them to mental health issues. So Preston, in 2010, they had a very interesting policy to develop well-being days. So over 10 days, several actors were regrouped around the city council to offer physical and social activities to the citizens of Preston. They developed a clear vision, which is a policy choice, to develop a world-class health system to enable people to live longer and healthy lives and to address health inequalities. Preston faces and faced many challenges to the health of its population, which they aim to tackle by improving health through physical activity and healthy eating, and enhancing specifically the mental well-being through community engagement and community empowerment. The driver of this action and policy was to decluster deprived and privileged areas and develop a policy geared towards developing the full health potential of the citizens. As we can see, having a policy to encourage physical activity, social inclusion, is addressing mental health as a priority. There were 10 specific areas identified based on the mapping of inequalities that was done to develop these activities, and a total, I think, about 90 projects are still ongoing there to address mental health, well-being, physical activity, and social inclusion. The second example, as I mentioned, is also highlighted in this global report I mentioned previously, which is named Hidden Cities, Unmasking Urban Health Inequities. It's about Brazil and violence prevention. Brazil has one of the highest homicide rates in the world. We had an example in Sao Paulo where this rate almost doubled over 20 years. And there, the local government decided to address violence through community involvement and the recreation of social ties. Within a deprived area, a conglomerate of slums named Jardim Angela. And I'm sorry, Paolo, if I misspell it or missay it. The alliance created with the civil society was supported by policies to limit access to alcohol, for example, by closing times for bar, programs for domestic violence, health information to reduce teen pregnancy. And in the meantime, there were community spaces that were reappropriated, recreated, and squares and schools rebuilt to provide a common space of socialization. The achievements are impressive. We've seen a 51% reduction in homicide, and 50% reduction in reports of muggling, assault, car theft compared to the preceding years. And these figures are from 2006. So here again, a policy which initially doesn't address specifically mental health, but one of the risk factors has a tremendous impact on mental health of the population. Let me go to another example, which I mentioned already earlier, which is age-friendly cities. And I took the example of New York here, New York City, because New York became the first age-friendly city certified by WHO in July 2010. So the World Health Organization Age-Friendly Cities Initiative has developed some guidelines to help cities to cope with an increasing aging population. One of the common traits between young adults we mentioned many times during this forum and the age population is that they are both particularly vulnerable to mental health issues. So New York City set a 4-year commission for an age-friendly New York City with leaders from both the public and the private sector in 2010. And in its first year, the commission focused its attention on what they call age-friendly businesses, age-friendly schools, colleges and universities, and aging improvement district. And they are now expanding the experience to new initiatives such as age-friendly technology and age-friendly professions. So what all those mean? Age-friendly businesses, for example, is a very interesting initiative where there was strong discussion between the city hall, different various communities on the specific needs of old people when they were shopping. And then they realized that, well, people were not going out and were desocialized even in shopping because there were no places to rest after a short walk. So they encourage businesses to install chairs in many businesses in New York City so that all people can shop and rest and then re-socialize by engaging in discussion with the shops and resting. Another similar initiative, slightly different, is now conducted in Switzerland, and I think it's in Lausanne, where they developed what they call city gardens or city paths, where they discuss with different communities the different needs. And for example, they came up with the conclusion to lower and have some special sidewalks where not only for disabled people, but also for women with young children with carts, etc. And also in the pathways to some public services, put benches so that people can sit and relax and sometimes re-socialize by reconnecting different parts of the population which were completely clustered. These are three of the initiatives we deem like very interesting and positive. Now let me go to one which is maybe a little bit more on the not so good side. In Japan, there's a phenomenon that we call kodokushi. Kodokushi. It means lonely death. And in Japan, there's a growing occurrence of these lonely deaths. Basically, this means that a person lived alone, died alone, and then the green part of the body stays in the place is undiscovered for many, many weeks, sometimes months, sometimes years. And because of this, you have thick, dark stains shaped like a human body on the floor. This is what this means. So there was a specific study after the earthquake in '95 in Kobe, which was a very big earthquake, the city where I'm working now. And one of the conclusions was that this was, of course, a disaster-related issue, but not only. This was beyond simply a disaster-related issue, and that there was a need for policymakers to address this issue because of the growing aging population in Japan. Unfortunately, the local government rejected any further investigation, and to date, this phenomenon is not specifically addressed by the local government. So we might experience, and we're still experiencing, a phenomenon which, here there was a policy choice that denies an intervention, which is probably from what we might call bad governance. Let me conclude my presentation, and I would just like to re-emphasize on three main ideas I developed. Social and health inequities in cities is closely related to mental health. And public policies will have an impact on mental health outcomes, any public policy. Also, I would like to emphasize the fact that local governments' policies, they do have a significant influence on mental health outcomes, even where national and regional policies take precedence. Thank you very much.